In peritoneal dialysis, the peritoneal membrane is used as a filter. So dialysate is then infused into the cavity through a catheter, and then it's drained. When the bag is lowered, fluid comes out. No, the drainage should absolutely look clear and kind of straw colored. If you see drainage that's cloudy, that indicates infection. That's a big deal. If not, all the fluid comes out in peritoneal dialysis. Turn the patient from side to side, reposition them. Different types of peritoneal dialysis, there's CAPD and CCPD. Please see my notes for notes on that. Complications include infection, which the cloudy drainage is your number one sign. See those under complications. Dietary needs, patient needs increased fiber and increased protein. For CRRT, I'm sure some of you have seen this in your ICU rotation. It's a machine that's wheeled into ICU. It's for patients that aren't hemodynamically stable. Well, obviously they're not hemodynamically stable, but it's for your patients where their cardiovascular system is too fragile to then take them to a different unit. So dialysis is brought to them. Never more than 80 mLs of blood is taken out of the body at one time because their cardiovascular system is too fragile. And let's start with DKA. DKA is a serious life-threatening event caused by insulin deficiency, characterized by hyperglycemia, ketosis, dehydration, and electrolyte imbalance. Usually affects patient with type 1 diabetes, but you can see it in type 2. Starts from infection most commonly, and it's the most common cause of mortality in people with type 1 diabetes. Causes new onset of type 1 diabetes mellitus. That's actually what you see in kids. They'll have a DKA episode first, and that's kind of how you will know that they are type 1 diabetic. Another cause could be illness or infection, stress. Maybe a patient forgot to take their insulin. Pregnancy could be a cause. Maybe the patient has an insulin pump that's malfunctioned, or certain medications. Signs and symptoms, you'll see nausea, vomiting, the 3 Ps, which polyuria, polyphagia, polydipsia, weakness, weight loss, anorexia, abdominal pain, cramping, tachycardia, you'll see Kussmaul respirations, fruity breath. These are your patients that come in that have a blood glucose greater than 300. You'll test the urine, and it'll be positive for ketones. Serum bicarb is less than 15. Arterial pH is less than 7.35. Potassium can be normal. It also can be elevated. LFTs could also be elevated. Treatment for a patient in DKA, IV fluids, obviously. Give 1 liter over an hour, use normal saline, continue with fluid resuscitation, replace insulin, replenish electrolytes, depending on what electrolyte abnormality is happening. Patient education, you just want to educate your patient on proper diabetes care. And also educate your patient on the signs and symptoms that go along with DKA. DKA in the pediatric population, most common emergency in peds nursing. Most of the time there's a delayed diagnosis. Adolescents, you'll see a lot come into the emergency department in DKA because they just don't take their insulin, or they, whether they forget or they choose not to. Also, when someone just gets a pump for the first time and they're trying to figure it out, DKA can occur then. It's the leading cause of morbidity and mortality in children with type 1 diabetes, and cerebral edema accounts for more than half of all DKA-related deaths.